This year was a very interesting year in terms of clinical research in ALS. Professor Mohammed Sanjak, who is our lead physical therapist and a senior scientist at the Carolinas Neuromuscular ALS-MDA Center, published a paper on the analysis of vestibular function in ALS patients early in the course of ALS, before they have significant weakness or spasticity. This was a very important finding because we have identified that patients with ALS have a particular balance problem that had been inherent in the medical literature and has been studied in great detail. Mark Weisskopf, a professor at Harvard School of Public Health, who has been very interested in looking at the history of falls and head trauma in ALS patients prior to the onset of ALS, identified that this paper was very important in sort of delineating that there may be a specific risk factor for developing ALS based on the balance problem. The work here from the Carolinas Neuromuscular ALS-MDA Center is specifically showing that patients who are not weak, those who are having normal balance tests by standard physical therapy tests, do have an early vestibulospinal problem that they can correct with visual input, and further research has to go forward in this regard. This is a landmark study showing that there is potentially a marker for the early changes in the nervous system in amyotrophic lateral sclerosis. The Carolinas Neuromuscular ALS-MDA Center is a leading center working with the University of North Carolina School of Medicine and other institutions within the state of North Carolina as well as South Carolina with respect to the development of drugs for amyotrophic lateral sclerosis. The research efforts led here from the James G. Cannon Research Center, ALS Laboratories, have been working together with Hee-Ming Key, professor of biochemistry and biophysical chemistry at the University of North Carolina School of Medicine, to try to develop new compounds that would enhance the effect of riluzole, the standard therapy in amyotrophic lateral sclerosis. We have identified through a literature research that there is a specific way that riluzole may be working that hasn't been looked at in terms of enhancing its effect since the drug was first found. We are collaborating with pharmaceutical companies that have specific kinds of drugs that may enhance the research effect of riluzole and are planning clinical trials to see if these drugs could be effective in patients. These are drugs that already exist, have been exposed to patients with other diseases, and may be repurposed for amyotrophic lateral sclerosis. In addition, through what I call the Kitty Hawk Initiative, we are working very closely with the University of North Carolina School of Medicine, with which the Carolinas healthcare system is affiliated through having the University of North Carolina School of Medicine Charlotte campus here in Charlotte. The work that is ongoing now has identified that there are new compounds that are much more robust and have better clinical effects in animal studies than the current drugs that are going to be tested in the near future in patients with amyotrophic lateral sclerosis. Our hope is to create a whole new class of drugs that will enhance the effect of riluzole and take advantage of the fact that this is a medicine that has a definitely robust effect on the course of amyotrophic lateral sclerosis. It's just not leading to a cure for ALS yet. We feel that if we put our efforts into strategically enhancing the effect of this drug and trying to look at an effect that is presently working in ALS and trying to enhance it, that we may possibly get to the point of having a cure for ALS. The Edwin Holt Communications Laboratory, led by Catherine Amy Rice, the speech pathologist, is collaborating with a number of centers on specific studies in speech and swallowing. The most significant advance has been to look at a standardized tests to see whether there are abnormalities in speech and swallowing in ALS patients that we can identify by using these quantitative clinical testing to show that there are changes in the ability and response to treatment. The clinical drug new Dexta was approved by the Food and Drug Administration. They are using the standardized clinical tests that we've developed. And other universities, such as the University of Toronto, have also embraced using our standard clinical tests to correlate with some of the more sophisticated scientific tests that they use in speech and swallowing.
Right. I'm here with Robert Flanagan and Todd Dewey. We work at the ALS Center here in Charlotte. Our center is a multidisciplinary clinic. We provide services to people who have ALS, and we provide support and care for the patient and their family. Here we go.
I'm John Shea.
Hi, I'm Gil Shea.
And I'm Mike Shea, and we're here to take the ALS Ice Bucket Challenge.
Now, we nominate you.
I am so honored and so excited to be taking the ALS Ice Bucket Challenge today with my friend Louise. And let me tell you why. My mom lost her courageous battle with ALS 17 years ago. And in her memory, I co-founded PinStripes, a charity that benefits the ALS Center here in Charlotte, with Ed Holt, who lost his courageous battle with ALS 10 years ago. In 15 years, PinStripes has raised over $3 million. Today, I challenge all of my friends and all of my coworkers across the cable industry to take the ALS Bucket Challenge and to donate money to PinStripes. I will personally match up to $10,000 given to PinStripes. Thank you, and join me now.
This is Bill Hampton, and I am honored and proud to have helped Carole Hart with her PinStripes Foundation. I want everybody to donate. All right, let her go. Let her
go. I'm here to support my friend of over 20 years, Carole Hart, and be a part of the ALS Ice Bucket Challenge. Step up, dig in, and join us to fight ALS.
Thank you to Carole Hart for challenging all of us to do the ALS Ice Bucket Challenge, benefiting PinStripes Fund through Carolinas Healthcare Foundation. Oh my God. That is so cold.
Hey everyone, it's Bill Spencer, and I'm here to do the Ice Bucket Challenge. I also want to nominate some special people to follow me in this challenge. First is Dave Ponalvis, also known as Big Daddy. Second is my SEC brother, Jay Brown. And last is my special friend in Charlotte, Heather O'Blinger. Okay, here we go.
Oh, hilarious.
Nominated for the Ice Bucket Challenge by Hannah Smith, and I accept your challenge. I'm doing this in honor of Ed Shea, my husband. Never give up.
Hi, my name is Steve Berline, and I was nominated by my wonderful daughter, Kaylee, to do the Ice Bucket Challenge. So I'm doing this in memory of my very good friend, Jeff Shear, and also in support of Ed Shea. Ah! Careful! Oh!
All right, this is the Ice Bucket Challenge. I'm dedicating this actually to my cousin, John Pizzarelli, who passed of ALS, a friend of mine, Ed Shea, who's battling it right now. Here it goes. I'm waiting. All right.
Carole Smith. I'm a nurse with the ALS clinical team. I'm accepting this Ice Bucket Challenge from a coworker. But this time I would like like to nominate Scott Holston, our physical therapist, team, and also my husband, Robert Smith. I would like for you to take the ALS Ice Bucket Challenge.
I'm Scott Holston, the physical therapist. I'll take Nicole's challenge and challenge Mike Fisher. Go for it. Go.
All right,
Go for it.
So my name is Mike Fisher. I'm a clinical dietitian here at the ALS clinic. I happily accept Scott's challenge, and in turn, I am going to nominate our new social worker, Shivani Thorne.
All right.
Elwin, I am a speech and language pathologist here at the clinic. I accept challenges from my colleagues all the way at Massachusetts General Hospital as well as Amy right here at the clinic.
My name is Mindy Nichols. I'm one of the nurses at the clinic, and I accept the challenge on behalf of one of our patients, and I nominate my son and any other ALS clinic that wants to do the challenge.
All right, Mindy.
So Dr. Bockanek and I, who are very important, and he's been very important in the foundation of this clinic, and we've been carrying on his efforts. We've been challenged by all the ALS clinics throughout the United States to make this into a contribution to the Ice Bucket Challenge. We accept that challenge. And we challenge the University of Oxford, Kevin Talbert, and Martin Turner to do it in England. A great event. I want to cap it off by announcing that the Carolinas Neuromuscular ALS-MDA Center will be initiating a new clinical trial, first time in the United States and the world, on the treatment of ibudilast in early ALS patients. We initiated our site initiation visit yesterday, and we'll be moving forward. This is part of an overall Kitty Hawk initiative at the Carolinas Neuromuscular ALS Center and the Cannon Research Center, looking for developing treatments to add to the effect of ALS and to add to the treatment effect in ALS so that we can push toward a cure, not just slowing the rate of progression. Thanks to everybody for participating today. This has been a great event. Thank you.